Started. Hi, everyone. Good morning, good afternoon, something in between. Welcome to our patient day for NMOSD and MOGAD in Washington, D.C. I'm so excited to be in the nation's capital. No one mentioned my outfit, but I will point it out. I'm wearing red, white, and blue, trying to be patriotic here. The weather and humidity in D.C. is not really working for my hair, but I hope my outfit makes up for it. So anyway, everyone, welcome. Thank you for being here, especially on a Sunday when you could be doing anything else. My name is Sumaira. I'm a patient living with seronegative neuromyelitis optica spectrum disorder. I have been living with NMOSD since 2014, so it's been 11 years. I will share a bit about my story and the foundation just in a few moments, but before that, I just wanted to say how appreciative we are of all of you coming out here and joining us today. It's especially the patient panelists and the caregiver panelists. I know how much courage it takes, especially with cameras everywhere and so many strangers, to come up here in front of all these people and share some of the worst days of your life. So we recognize that, we appreciate you, and I have no doubt that every single story that's told today will be impactful to someone either here in the audience or someone watching in the replays. So the first thing is I'd love to thank, he's not here today, but Dr. Ben Osborne, who's a neuro-ophthalmologist at Georgetown MedStar. He was our collaborator on this fantastic event, hopefully, and unfortunately he couldn't be here today due to a family emergency, but when he watches the replay and with hopefully his colleagues and patients telling him, we are very, very grateful for his support and partnership on this event. I'd also, again, like to thank all of our panelists, the clinicians, the patients, the caregivers. Your expertise, your insight, your experiences are so valuable. Of course, our sponsors, thank you Amgen, thank you Alexion, UCB, and Genentech for your support. We couldn't have done this without you. And then, of course, the TSF team, Michael Devlin, stop walking away, raise your hand. That's Michael. He is a strategic board member and advisor to the foundation, sort of the yin to my yang. We fight all the time, but it's all for good reason. And then we have Jill here. She's our chief of staff. I'm sure many of you have already met Jill. Jill is obviously very, very important to the foundation and helps with all of these events, putting them together. Of course, our ambassador, we have Nell Choi here. Raise your hand, the one and only Nell. You will hear a lot about her story today, but I just, a little anecdote. Nell and I went to dinner last night, and we were talking about the colleges that she's looking at. And then when I came home to my hotel, I was like, oh, that's really weird, because I remember when you were 9 and I saw you on like CBS News and you were in elementary school, and now we're talking about colleges, which is insane, and sharing clothes. So that is Nell Choi. You will hear about her story. Dr. Maggie Kang, raise your hand. She's a caregiver. She's Nell's mom. She's a member of the foundation. You will also hear from her today. And then Brian Dawson, raise your hand. He has MOGAD. He's here from Enola, Pennsylvania with his wife. And you will also be hearing his story today. So raise your hand if this is your first time coming to a patient event. Okay, that's a really big deal, guys, because when you have a rare, yes, when you live with a rare disease, it's so hard to come by opportunities to meet others who have a rare disease. So this is definitely a big moment. Lean into it, embrace it, feel all the feels. I remember the first time I met another patient living with my condition, and it was almost life-changing. It was a disease-altering kind of moment. I finally realized, like, wow, I'm not alone in this. I'm not the only one feeling and experiencing all the things that I'm feeling. So I'm very happy for you guys to experience this. I do have a little cheesy exercise. I never tried it before, but I wanted to try it here. You have some pens and notepads on your paper. Particularly the patients and the caregivers, I have a request. Can you please take maybe a minute or so to write down maybe 3 adjectives of what you're feeling in this very moment being at a patient day for NMOSD. It could be nervous, excited, scared, whatever, but just write down 3 adjectives. I'll give you a moment. I guess the doctors can do it too. Why not? Okay, great. We're going to come back to this at the end of the day, but oh gosh. Okay, so today is about you, okay? We've organized this event to make sure that you leave today feeling informed, educated, connected, seen, supported, included, and welcomed. So that being said, I want you to ask questions. There is no such thing as a dumb question. You know, don't be shy. Make friends. Make memories. Get all of what you can out of this event. If you have questions about treatments, or if your diagnosis is correct, or if there are clinical trials available, just ask. That's what we're all here for today. So with that being said, I think we will get to my presentation. But lastly, I just want to say there is so much power in community. None of us should be going through any of this alone. And, look around the room. There's so many of us actually, considering that we have a rare disease. So once again, lean into the power of community. In some way, shape, or form, we're all like a family, maybe a bit dysfunctional, but that's okay. Family is family. And yeah, we're all here for each other, and that's how it should be. So I will now tell you about the foundation. Okay. All right. Yeah. I love to start my presentations with this quote. It says, "A rare disease may also bring rare gifts: perspective, resilience, creativity, compassion, connection, and love." And that is absolutely true. I feel that every day. 11 years of living with this disease, but also doing patient advocacy for this disease. In a weird, twisted way, I feel like my personal life got so much better because of the disease. Of course, I don't wish this for anybody. I don't want people to be sick, but I hope that we can all find the silver lining of getting, either NMOSD or MOGAD. So let's talk about the Sumaira Foundation. How did it start? What is it? So this was me 11 years ago. I lost significant vision in my right eye. I couldn't feel the left side of my body. And at first, I was diagnosed with idiopathic optic neuritis. They told me that I had a 16% chance of developing multiple sclerosis at some point in my life, and that I should move on with my life and that my vision would return. 5 weeks later, I ended up in the hospital, and my symptoms had truly escalated. And that's when we realized that actually this might be more than what we originally suspected. So long story short, I was diagnosed with seronegative NMO. It was not NMOSD at the time. NMOSD became a thing, I think, in 2015. And we didn't have the FDA-approved therapy. So my disease journey was a little bit different than what I probably would have experienced in 2025. But as you can imagine, I was 25 years old. I had all these dreams that all of a sudden were totally shattered because of my diagnosis. Not to mention I couldn't see, I could barely walk. So I took to my blog. I had a lifestyle blog at the time, and I wrote about what had happened to me. And mostly to inform my broader community without having to text every individual person. But also, it was a form of catharsis. I needed to talk about what was going on because I still couldn't wrap my head around what had happened to me. And overnight, my blog post had gotten about 15,000 hits. For me, in 2025, that would also be a lot. But in 2014, I thought to myself, whoa, 15,000 views overnight, that's a lot. And what that told me was that maybe I needed to raise awareness about this. Maybe I needed to use my voice and my platform to bring awareness to this rare disease. At the same time, I received this beautiful quote that still chokes me up a little bit to this day. It read, "There was a flower in her heart. It just needed more room to bloom. And when she let it free, she showed the world that sometimes the most beautiful things can grow in the darkest of places without the need of light." That kind of was my tipping point where I was like, all right, I got to do something about this. So a month after my diagnosis, I wrote to the Boston Magazine and I said, I'm going to start a foundation. I need you guys to help me announce this. For those of you who don't know, I worked in public relations and the entertainment industry before I got sick and in healthcare. So I had, I think, all the right connections to do this. And so I had no idea what I was doing, but I decided I was going to start the foundation. And so here we are. So we are dedicated to illuminating the darkness of now rare neuroimmune conditions. We raise awareness, we support the community, we support research, and we advocate on behalf of patients. We have 4 pillars. They are awareness, community, advocacy, and research. We are truly patient-led, patient-powered, science-driven, and therapy-agnostic. Our icon is this beautiful pink Gerbera daisy. Our mascot is the unicorn right there, and that's to commemorate a little girl named Joanie who passed from NMOSD in 2019. And our official colors are pink, orange, and marigold. I clearly like color, so it's not surprising. And despite what any administration is saying, we still believe that diversity is a superpower, and I will die on that hill forever and ever. And that is reflected in our International Medical Advisory Board, our Global Ambassador Program, our multi-language content and programming, and our local country organizations. We are a global organization now. Of course, we have an entity here in the United States, but we also have TSF Canada, TSF France, TSF Italy, TSF Germany, and now we're actively expanding into the UK as well as the Kingdom of Saudi Arabia. But that doesn't mean that that's where our work is confined to. We are working everywhere, supporting as many people and countries as we can. Our website is available in 26 languages. For those of you who don't know, I'm Bengali, and my mother tongue is Bangla, and my parents also obviously speak Bangla. And when I first got sick, them not being scientists or even doctors, they had a lot of trouble kind of understanding what it was that I had, especially because it was in English. So that was an impetus for me to make the website available in all these other languages so that folks like my parents or whoever else can at the very least understand all of this very difficult medical jargon in their native languages. Here are some highlights of the foundation. So we've shared over 175 stories from patients, caregivers, and clinicians around the world. We've produced about 140 webinars in 13 different languages. We developed the first ever interactive therapies chart for FDA-approved NMO therapies. I believe we have printouts of them out front. In terms of community, we have about 100 ambassadors now representing 35 countries, a bit like the United Nations. Hopefully more effective. We've organized 15 patient days in 5 countries since 2022, and we have support group meetings in 10 different languages and countries. In terms of research, we've funded about $1 million in seed grants and fellowships and journal publications. We've graduated 7 fellows from our diagnostic fellowship, and we are a recipient of 2 PCORI funding awards, which I will get to momentarily. In terms of advocacy, we've secured about 40 state proclamations to recognize NMO as March is NMO Awareness Month and MOGAD. April as MOGAD. I need more coffee, Michael. April as MOGAD Awareness Month. And then we've also co-developed treatment and diagnostic guidelines in Latin America. So, of course, the foundation has my name on it, but it takes a village to do all of this. I don't do all of this alone. I won't read every name, but we've got a core team, and then we have board members, strategic advisors. We're all spread out across the world. Here is our medical advisory board that is chaired by Dr. Michael Leavey, who is at Mass General Brigham. These are some of the biggest names, I would say, in neuroimmunology worldwide. These are our industry partners who we've been working with. Community partners, I believe in collaboration. I think we'll go a lot farther if we work together. and I want to tell you a little bit about the Ambassador Program. So when I came into the scene 11 years ago, I came in with a totally objective perspective. I did not work in rare disease at all, and I had never really been a patient that had a serious condition before. So this was sort of my vision board when I entered the scene 11 years ago, and I said, this is how it should be. Patients should always be at the center, and around us should be all these different stakeholders: caregivers, clinicians, scientists, researchers, advocates, insurance companies, pharmacies, allied health professionals, policymakers, and these folks should all be working together to ultimately uplift the patient. So with that sort of in mind, we launched the Global Ambassador Program in 2019 to provide an infrastructure for any of these stakeholders to join us to help us kind of move the cause along. So our TSF ambassadors are patients, caregivers, clinicians, scientists, and researchers and advocates. Now we have 99 ambassadors. We're about to break 100, 18 of whom are clinicians, 13 caregivers, 3 pediatric patients. 85% are female, from 32 countries, speaking 28 languages, representing all of these different demographics. TSF ambassadors are sources of hope, information, inspiration, knowledge, and resources. These are people who are volunteering their time, their energy, their emotions, their expertise to pay it forward to others who are in need of help and support. Here they are, many beautiful faces of our ambassador program. And now let's talk about some of the programming that we do. So we're very passionate about patient education that stems from this very simple notion of knowledge is power. The more we know about our disease, the more comfortable we are talking about our diseases. Hopefully that resonates to better health outcomes. So we've got webinars, podcasts, case discussion and lecture series, interactive therapies chart, infographics, and all kinds of guides on our website. If you haven't yet visited our website, please check it out. They're all available, free, downloadable, and available in multiple languages. This is our new brochure that hasn't yet released. It will actually release next week. We've been working on this for the last 5 months, and also comes from the fact that when you get diagnosed as a patient, you're given this horrible news, and like most of the time, no information to walk out with your hands. So then you're left to go to Google, and Google's telling you have 5 years to live. So to kind of avoid all of that, we've designed these brochures that will soon be available in neurology offices, MS centers, and centers of excellence, infusion centers around the country. Yay! I actually have a few. I don't have that many left, but if you want one, hopefully I can get you one. But I would love to hear the feedback of the community. If you think that this is helpful, we want to make these available in Spanish and in other countries and other languages. We're actually launching this program next week. It's called Side by Side. This is an exclusive peek here, but it's about shared decision making. Again, another concept that I don't think is widely understood or even known in our community, but it exists, and it's basically designed to help you as a patient have better health outcomes and work in partnership with your doctor. So we're releasing these video series with Dr. Leavey in it actually, and a real patient, Marion Jones. She's an ambassador, and all kinds of guides and infographics. So again, check it out. It will be available next week, but I'd love to hear the feedback from the community and see if this is something that's helpful to you or helpful to somebody that you know. We share stories, as I said, Voices of NMO and MOG. We've produced documentaries. One of our documentaries from France actually became a finalist at the World Health Organization Film Festival. I was in a documentary with Dr. Sean Piddick that aired on PBS a few years ago. It's available on YouTube. As I always say, watch it, but I am an ugly crier, and I'm crying like half the time in this, so. We have all of these different support group meetings in all these different countries and languages. These are all run by our ambassadors, actually. These are all the patient days that we've done and are going to. So after this, we're going to Chicago next month, Salt Lake City in August, part of ECTRIM's Patient Community Day in Barcelona in September, Seattle in October, and then Germany and France in November. I always joke and say that I feel like I'm on like a little Beyonce tour for NMOSD and MOGAD. Here are some pictures from our patient day. So we are going to be doing a group photo here in DC today. Let's make it better than all the other ones. Boston, Cleveland, Atlanta, Miami, Paris, Verona. This was our most recent patient day at Stanford in San Francisco. This was from Patient Community Day in Copenhagen. I had the honor of speaking and representing our communities there. This was from China last year. That was a cool event. This was in Beijing. Very, very cool, very well organized. Lots of patients from all over China joined us. We have an app called NeuroSum. It's a symptom tracking app, but also helps you to hopefully prevent relapses. There should be more information about it at the front desk. Our mascot is this unicorn, and so we have this pediatric support program where anytime I become aware of a patient under the age of 18 who's diagnosed with either of these diseases anywhere in the world, we send them the unicorn bracelets, all the things, and a handwritten note from me. Advocacy is a big part of what we do. So we have our Patient Advocacy Council. This steering committee consists of doctors, patients, caregivers. We all get together. Dr. Shin, I think, is a part of that. And trying to understand how the unmet needs in diagnosis and treatments, access to treatments and whatnot. Same thing with the Coalition for Health Equity. Again, if it's not obvious, I'm very passionate about diversity, equity, and inclusion. And so Dr. Shin's also part of that. Thank you for that. And similarly, we try to understand and learn, listen and learn from the community. What are the unmet needs, specifically for those who are underrepresented? What can we do to sort of help people get diagnosed quicker, more accurately, get on the right treatment, get connected to the right doctors, be relapse-free, etc. March is NMO Awareness Month. April is MOGAD Awareness Month. And to celebrate and to raise awareness of our diseases, we do landmark illumination. So this is a very busy square in Shanghai where we raised awareness with our partner for China NMO Day. These are illuminations around the world that we've had illuminated pink for us. So that's Niagara Falls, a stadium in Italy, the Zakim Bridge in Boston, Empire State Building, Michelangelo in Italy, the CN Tower in Canada. So we've done hundreds of these by now, and every time it's very magical. This is our Belgian ambassador representing the foundation at the European Parliament, advocating for early detection in rare diseases. And then this is a bunch of us as part of the Every Life Foundation's Rare Disease Week on Capitol Hill. It happens every year. Annual event, so cool, so wonderful, very fun. We all get to meet our local, senators, congresspeople, House folks, and really make the case about why rare disease needs to be prioritized. We work with all of these different patient assistance programs in the U.S., so the PAN Foundation, the Assistance Fund, Good Days, NORD, and these organizations exist to fill in some of the gaps, let's say for copay assistance, if you need an Uber ride to and from, infusion appointments. They have all kinds of services. Research. So our research efforts really started, I would say, in 2018. We have been funding these seed grants up to like $25,000 a project. So Spark Grants is for adult research, and then pediatric research is a part of Joanni's Unicorn Grant. This is again to honor the little girl who passed away from NMO in 2019. And since 2018, we have funded 32 projects around the world in the amount of about $830,000. These are all the fellows that we've graduated from the University of Oxford, the University of Verona, and Mass General. The whole point of these fellowships is for folks to learn how to do live cell-based assay diagnostic testing, to train the trainer program so that these doctors can go back to their countries and set up labs and diagnose folks better. So we've graduated fellows from Iran, from Zambia, Sri Lanka, Brazil, Egypt, and Belgium. Hopefully more to come. We also funded the current Ektrem's Meaden Fellow. She is Dr. Antonia Lefter from Romania. She'll be spending 2 years at the University of Oxford with Dr. Jackie Pallas, doing more on NMOSD and MOGAD. We support journal publications so that doctors all over the world can get their fabulous work published in open access journals. This is super important. We have research summaries. This is helmed by one of our ambassadors. She's an NMO patient from India. Her name is Clarinda, and this is her sort of brainchild. She takes very complicated research articles that are so wonderful that many of us who are not in science do not understand and translates them into plain language summaries. They're all available on our website, and we have infographics made so that people like you and I can understand what is going on in research. Last year, we were awarded a $250,000 PCORI award, so that's Patient-Centered Outcomes Research Institute, and it was to address the gaps in research for NMOSD, MOGAD, and other rare neuroimmune conditions. It's to build capacity and develop a research agenda. We are working with all stakeholders, so patients, caregivers, doctors, industry folks, and advocates to develop this. And recently, in April 2025, we were notified that we received a $9 million funding award from PCORI to conduct a 5-year comparative effectiveness trial for the approved NMOSD therapies and the off-label therapy. So it's the first... Thank you. I know, sometimes I can't even believe what's coming out of my mouth when I say that, but yeah, it's still processing. But it is the first ever comparative effectiveness trial for NMOSD therapies. We're going to be enrolling about 540 patients from 10 different clinical trial sites around the world. We're using innovative adaptive therapies, trial design platforms, and this has never been done in NMOSD, but this is the first ever PCORI award for a patient advocacy organization, especially of our size, to conduct such a study. And we're hopeful and confident that there's a lot that we're going to learn over the next 5 years that will only help NMOSD, our patients, and hopefully other rare diseases. These are some of our research initiatives, things that we're interested in. Very exhaustive list. I will not read it. But is anyone seronegative here besides me? Anyone? Okay. I need to like do a scratch ticket somewhere. All right. And this is just a funny picture from our 10-year anniversary in Beijing. I love to show it because Michael Leavey and Michael Devlin are wearing birthday hats here. So funny. He hates this picture. I love it. So happy 10 years to us. And this is how to get in touch with us. So again, thank you so much for being here. Thank you for your time, your energy, and your attention. I hope you learned a bit about us and feel connected.